Avec la slide art.
Bonjour tout le monde. Alors, c'est notre plaisir aujourd'hui pour notre séminaire CerebrUM d'accueillir Professeur Denise Klein. Je vais faire une introduction. Alors, Denise Klein, elle est professeure au département de neurologie et de neurochirurgie à l'université McGill, membre régulière de l'Institut neurologique de Montréal, de Neuro. Elle a obtenu son doctorat à l'université de, là, je vais faire attention, I'm going to make sure I pronounce this right, Witwatersrand, à Johannesburg, où ses recherches doctorales portaient sur les troubles du développement de la lecture chez les enfants bilingues. En 1992, elle a rejoint The Neuro en tant que chercheuse postdoctorale sous la supervision, je ne vais pas dire, pour des raisons que j'expliquais après, à une période marquée à l'essor technique d'imagerie fonctionnelle pour l'étude de la représentation neuronale du langage. Ces recherches portent principalement sur l'organisation linguistique du cerveau, le bilinguisme et l'imagerie fonctionnelle et anatomique du cerveau. Elle utilise alors la tomographie par émission positron, en fait, l'imagerie par résonance magnétique, l'IRM, et l'IRM fonctionnelle pour examiner les modifications du flux sanguin cérébral lors de différentes tâches linguistiques. Puis l'un de ces axes majeurs concerne l'identification des régions cérébrales qui sont impliquées, comme vous allez voir aujourd'hui, dans le traitement du langage bilingue. Et ces études d'imagerie ont également une très grande pertinence clinique, notamment dans la cartographie des zones cérébrales du langage chez les patients atteints de lésions focales qui nécessitent une intervention chirurgicale. Elle dirige un programme préchirurgical de cartographie fonctionnelle du cerveau à l'Institut neurologique de Montréal, qui intègre IRM, IRM fonctionnelle et la TEP aussi. Et ce programme vise à optimiser les procédures diagnostiques préopératoires chez les patients souffrant de tumeurs et des foyers épileptiques et de malformations vasculaires et d'autres lésions cérébrales situées dans des zones critiques pour le mouvement, la vision, la sensation et le langage. Professeur Klein est aussi la directrice du CerebrUM. Le CerebrUM, pour ceux qui ne connaissent pas, c'est un regroupement stratégique du FRQNT. CerebrUM, vous connaissez peut-être UNIC. UNIC, c'est aussi un regroupement stratégique c'est un research cluster, un regroupement stratégique du FRQNT. Donc, on a le même statut et je veux dire aussi que quand nous, on a fait notre demande pour le centre UNIC, la demande et le projet déjà en cours du CerebrUM, Denise a été gentille à partager aussi avec nous leur demande à eux. Ça m'a beaucoup inspiré UNIC. Quand on a monté le projet, on a fait la demande, ça nous a beaucoup aidé la demande qui a été faite par le CerebrUM. Et je pense que ça a contribué certainement en partie à notre succès aussi. Je sais que j'ai beaucoup parlé, mais je voulais garder quelques points pour la fin. J'ai échangé hier avec Denise, j'ai envoyé quelques questions très tard. Denise ne va pas me répondre parce que c'est tard, mais Denise m'a répondu quand même. Pour savoir quelques informations sur elle et que je voulais partager avec vous, mais je vais le partager avec vous un peu sous forme de quiz. Donc, je vais vous poser des questions. Vous allez lever la main, vous pensez que c'est la réponse A ou B, puis on va voir à quel point vous connaissez déjà Denise avant que Donc, la première chose qu'elle m'avait dit, c'est que, it's in English, but I'll be translating in real time in French, and then you can look at my brain and see what happens. Alors, elle a dit qu'il y a deux personnes qui sont nées à quelques jours de différence, qui ont une grande influence sur sa vie. Je vais vous donner une option A et l'option B. L'option A, c'est Noam Chomsky et Andy Warhol, les deux personnes qui l'ont plus influencé, qui sont nées la même année, quelques jours d'écart. L'option B, c'est Nelson Mandela et Brenda Milner. Maintenant, ceux d'entre vous qui se disent pourquoi tout à l'heure il ne voulait pas dire par qui elle écoutait. J'ai rien dit. Alors, qui pense que c'est l'option Andy Warhol et Noam? 2, 3, 4, 5. Seulement? OK. Qui pense que c'est Nelson Mandela et Brenda Milner? OK. Donc, la majorité a raison cette fois-ci, ce n'est pas toujours le cas, mais là, c'est vrai. Alors, deuxième question. Et là aussi, je skip quelque chose, donc quand je disais tout à l'heure, pour pas. Mais bon, je pense que si on me suivait, on l'aurait compris. Denise a grandi soit A en Australie, B en Afrique du Sud. Il pense que c'est A en Australie. Une réponse B, Afrique du Sud. Eh, bon, ok. Troisième question. One of her, non, un ou une de ses musiciens préférés. Deux options. A. Marlene Berman. B. Hugh Masekela. Qui pense que le musicien préféré, c'est Marlene Berman? A. Et à peu près 6 réponses, 7. Qui pense, 8. Qui pense que c'est Hugh Masekela? Alors ça ne fait pas le compte là. J'ai les 7 et 4, 11. Peut-être que la majorité silencieuse a raison, parce que c'est was a trick question, c'est les deux. Donc, ceux qui ont levé la main, on va que vous avez les points. Maintenant, dernière question. J'ai posé la question, je ne sais pas pour plus tard, alors j'ai dit n'importe quoi. Je dis, si tu changeais de carrière, ça aurait été quoi l'autre carrière que tu aurais fait au lieu de celle-là? Donc, option A, elle m'avait dit qu'elle serait entraîneuse de chiens Mira qui aide des personnes avec des disabilities. Option B, chanteur d'opéra. Réfléchissez parce que celle-là, c'est pas qu'il semble. Est-ce que vous pensez que training Mira dogs or opera singer? A, training Mira dogs. OK. B, opera singer. At least we tricked them in one. Okay? Donc, c'était la bonne réponse, c'était training Mira dogs. Donc, la majorité avait tort. Alors, sans plus tarder, on va accueillir, s'il vous plaît, chaleureusement Denise Klein pour sa présentation. Posez vos questions en français ou en anglais comme vous voulez, avec un profil en français, mais la présentation va être en anglais.
Well, I'm going to speak in English because I have a very strong accent in every language. But somehow works fairly well for English, but it's terrible for French. Anyway, so just to get everybody into the mood for an afternoon lecture, I'll play you something just to get you into the spirit of the topic of the talk. How do I? Let me just see how to change the slide. Okay.
Das hier ist mein Sektor. Das hier ist das wichtigste Gerät des Wissenschaftler. Das Überlebensradar. Thinking about das hier ist mein Sektor. Das hier ist das wichtigste.
All right. So I'm really interested in language because without good communication, as you can see from that video, life is really complicated. And I really feel like people underestimate the importance of language in our lives when they deal with neuropsychological testing or thinking about protocols for looking at health. And the reason that I think that we underestimate it, sorry, I'm just looking to see how, is that we worry about whether our children are going to learn their first words. Certainly at my age, everybody that I know is worrying about whether they're having word finding difficulties and whether this is a sign of something that's going wrong. And then in later life, a huge proportion of our population has word finding difficulties that are indicative of some kind of neurodegenerative or neurological disorder. And so people often present in the doctor's office with issues about children being late with first words or with word finding difficulties, and yet so little about our appointments with our GPs focuses on the questions about language. So my lab is interested in how our brains come to be organized for language. I'm interested in studying healthy participants, ways and ages of learning. Are there better learners? Tasks we can use to assess language, effects of different types of languages, effects of bilingualism, individual differences. I'm interested also in how work with healthy participants translates to patients risks for for brain lesions, for how we understand these in relation to language, tools for interventions, aging in language, neurodegeneration. I'm interested in relating imaging and behavior, more recently getting a bit involved in AI and machine learning. So looking at methods for studying normal and impaired language processing. And so most of my work has been looking at how we learn language in development when our brains are just starting out, fresh with information, and what happens when we learn languages when there's an already established system set in place. And a large part of the talk will focus on different kinds of language learning scenarios that I've used to address these questions. So one is to ask questions about bilingual language organization. So what happens when we learn one language and then another language later in life, or two languages from birth? What happens with different levels of proficiency? So just general questions around different types of languages and multiple language learning. The second area that I've done quite a bit of work on is work with international adoptees, because when you ask people when they've learned a second language, most people give you an approximate age. It's very difficult to know when people actually learned a second language, especially in a place like Montreal. People are being exposed to languages at all sorts of ages. So the definition or the cutoff age of when they've learned a language can be quite variable. And also people are constantly having exposure to language. In the case of international adoptees, they're born in China. These are the group that we've studied. They were adopted into Canada within the first 24 months of life. And we know exactly when they were adopted. And so we know what happens, or we explore what happens when they lose their first language and learn a second first language. So what happens in the brain gives you a unique view into critical periods. And then we've looked at people who learn sign language. And here you get people, in the case of bilingualism, people learn a first language within the first year of life. But in the case of sign language, there are lots of people that are born to hearing parents who may not be able to set systems in place for formal language learning early enough in life, or they live in a rural area. And so we get people who are born congenitally deaf who learn sign language, their first language, even after a critical period like in later years. And so what happens in the brain when first language is not established within that first year of life? And in all these cases, we look at the developed brain. So we're looking at adults, but we look back at the developmental history to sort of see what happened in infancy. So a lot of the work I'm going to talk about today focuses on these three groups. And my interest in language, as Karim said, started in South Africa with my PhD. There are 11 official languages in South Africa. But when I got to Montreal, there's also a rich linguistic environment here. And at the time that I arrived was with the advent of functional brain imaging. So most of you probably think it's been around forever. But actually, it's quite recent that we're able to look in the living brain and get a window into brain organization. And up until only about 30 years, our way of understanding what was happening in the brain pre-MRI was with either cortical stimulation in patients having brain operations or after a stroke. So it's really quite recent that we have this possibility of looking online in healthy participants for sure, and in patients at what's happening prior to some big event in the brain. So when I started out about 30 years ago, we were using PET scans, and a lot of the focus that people had was just at looking at the English language or unilingual processing. And so the first obvious question was, are the same brain regions involved for first and other languages? How are two languages represented in the brain? So the first study like this one, these are small sample sizes because you're putting people like you into the scanner, putting an IV line into the arm and injecting oxygen 15, so a water bolus with a bit of radiation. So we only had 12 volunteers in this study. They were English first language and proficient in French. And we looked to see what is the brain region that's generated, that's activated when they're performing word generation tasks. So they hear leap and they say jump, or they joli bell. I don't know, maybe got the grammar wrong, but that's the kind of thing they had to do. And you see, we can lateralize very strongly to the left hemisphere of the brain. We can localize to the frontal lobe. So you can see here, this is the left inferior frontal gyrus. It's activated. And when you subtract the French from the English, the frontal lobe peaks disappear, suggesting overlapping regions for finding words in a first and second language. Now, in this case, they learned French around the age of 4, and they were quite proficient in both languages. So we asked, what about languages that are more distinct, like Mandarin and English? And again, you see the left lateralization, the activation in the frontal lobe. And here, these were people who were Mandarin first language, English second language, and they were lower proficiency and only acquired English when they came to Montreal to study when they were around 18. So again, similar brain regions activated for lexical search and retrieval. And at the same time, Robert Zatori and Laura Petito looked at American Sign Language and Quebec Sign Language, so that's on the top. And they also compared them to hearing participants. And again, irrespective of modality, again, this left frontal lobe region activated for lexical search and retrieval. So this region that's important for finding words. So that's just to show you that kind of work that we were doing. So here you can see from the first study where I was looking at the English-French volunteers, if you take it at the same cut across 3 different conditions. In the first one, we're looking at generating a semantic search, so a synonym. In the second slice, you can see we're looking at a phonological search, so house, mouse. So in the first one, a semantic search like leap and jump or weep and cry. And in the second one, house, mouse, tactical, practical. And in the third condition, you can see an across language translation. So that's something like house, maison. And in this condition, you can see additional activity in the left basal ganglia, which was related to the increased articulatory output in producing the response in the non-native language. So we all have difficulty coordinating our organs of articulation, but the area that involved in search and retrieval was the same, irrespective of whether it was a within or cross-language search. And I'll come back to that at the end of the talk when I talk a bit about some of the clinical work that we did, because even though this is questions about bilingualism, it's setting the scene for understanding what brain regions we can lateralize with this information, we can localize, and we can do within or across language searches to activate these same regions.
Denise, very briefly, you prefer we keep all the questions to the end, or can we?
If somebody has got something pressing.
It's a very brief question
Yes, yes.
that I had in mind. You said the sign language in English, but also Quebec sign language.
Yeah.
For this, I was wondering, is this a comparison? So the task was the same individuals would see both, or you had separate groups? I just want to understand a bit
Separate groups.
those separate groups, and you'd be comparing sign language to.
That we're looking at which region is activated when somebody who is doing American Sign Language is searching and retrieving for a word. That's the picture on the left. The picture is if a deaf person, a Quebec Sign Language, and the bottom 2 are the hearing controls doing the same part. But if you subtract them, the same regions are subtracted out. So direct comparison of the groups shows that it's a common region that's activated. That's okay. So up until now, I've just been talking in general about asking people who've learned a second language about to do a task in the scanner. But there's a lot of discussion that there are critical periods for learning language, and that the earlier you learn language, the better you are. And I like the idea of Patricia Kuhl, so that's the bottom picture here, where she talks about children as being citizens of the world. So in the beginning, children, babies, turn their heads to the sounds of all languages that they hear. But by 10 months of age, they only turn their heads to the sounds of the languages to which they've been exposed. So we start out with this equipotentiality, and as we become more expert, our brains kind of prune so that we become expert only at our own language. And so we started to ask questions about age of language learning and what this would mean for brain organization. So I'm just going to give you a range of studies that we did where we looked at learning 2 languages from birth versus learning language second later in life. So this is a cortical thickness study that we did. So you measure the thickness of the cortex, the peel surface and the gray-white boundary, the blue and the red, and you can get a measurement of the cortical thickness. And this was a retrospective study where we took the MRIs of all the participants that we had done studies on, and we looked to see in about 120 participants. We compared their bilinguals to monolinguals, and the bilinguals had thicker left frontal cortex than the monolinguals. But actually, when we started to tease it apart, what we found was that the late bilinguals were driving the difference. So the later they learned their second language, the thicker their left frontal cortex. The earlier those that learned it between ages, so after age 7 had thicker left frontal cortex, between 3 and 6, a little bit thicker left frontal cortex. But when we directly subtracted monolinguals from simultaneous bilinguals, there was no significant difference in cortical thickness. So early organization for learning language takes full advantage of the period of greatest neural plasticity during early childhood. So when you set up your brain from the beginning, you can do it very neatly. But when you do it later in life, you've got to kind of pile on. You've got to bulk up in order to be able to do the task to the same level. And what we found, so we've looked at resting state connectivity, simultaneous bilingual have greater connectivity between the left and right IFG, and the stronger functional connectivity between their left and right IFG, the lower the functional activation of the left IFG required to achieve proficient speech. So there's some benefit to in the 2 languages for less neural requirement, greater gray matter density and simultaneous compared to sequential bilinguals in the basal ganglia. And what we found also was that in late bilinguals, the better the accent, the thicker the greater the gray matter density in this region. So both relationship between age of onset and also individual variability. We found that simultaneous bilinguals are better at perceiving speech in noise. So simultaneous learning associated with superior ability to benefit from contextual information and a different pattern of neural recruitment in the left inferior frontal gyrus. Simultaneous bilinguals show better cognitive control. And in the brain in resting state patterns, they've discussed the idea that the brain has networks that are anti-correlated with each other. So the stronger your attentional network or the more active, the more at rest your default mode network. And that this strength of anti-correlation correlates with a lot of positive scores. And so simultaneous bilinguals have stronger anti-correlation between the attention and the default mode network and superior cognitive control on some tasks compared to sequential bilinguals. They also have better phonological working memory, and we've done some network modeling with enhanced efficiency in the bilingual brain in corticocerebellar pathway. And really recently, we've been doing some neural network model training with phonemes, and again, there seems to be more training the model on many languages shows more efficient representations for language. So this is a picture a slide that was given to me from Alan Evans, and you can see from this that by 4 years of age, the brain is well developed. That's that panel on that side. But you can see really that the most rapid period of growth, the rate of growth, which is on this side, is really between 3 and 6 months of age. After that, there isn't much growth. It's just development, but the really rapid rate is between 3 and 6 months of age. So we turned our attention to study international adoptees because in them you can look at what happens within the first year of life. And some of this work was inspired by some behavioral work that Fred Genesee, I don't know if people know him in the room, had been doing with international adoptees. And so the interesting thing about international adoptees, you get a group that, so we studied them when they were adolescents, but they're born in China, they learn Chinese, and then they're adopted within the first year of life and they become monolingual French speakers. So they, even though they were exposed to Mandarin when they're adopted into Quebec, they no longer have access to Mandarin and no conscious recollection of being exposed. And we compared them to a group that were exposed to monolingual French speakers, born to French parents, learned French, and speak French all their life. And then we compared them to another group, which are children born in Quebec to Mandarin speakers. And they have continued exposure to Mandarin, but they also learn French. So they're all highly proficient speakers of French, but have different experience that's led to this. And we look at the neural traces, we looked at what's happening to the discontinued language and what's happening when they're processing French. So long before we did the study, I had done a study where we listened to, where we looked at how the brain deals with processing Chinese tone. And we compared two groups, native speakers of Mandarin and speakers of English. And I'm going to give you, well, you're going to see. Are those the same or different? Yes. Yeah, so everybody can do the task and perform at the same level of success, but to Mandarin speakers, these tones carry meaning, but to English speakers, you do the task non-linguistically. And what you see is that the Mandarin group activate a whole lot of left hemisphere brain regions, and the English group activate or do this task non-linguistically, even though they all perform at the same level of success. So linguistically relevant properties of auditory stimuli determine which neural mechanisms are engaged. And so we used a similar kind of a task to tap into what was happening with the Mandarin Chinese. So we gave them a tone discrimination task. And you can see, so these are the Mandarin French bilinguals. So they activate the left and the right hemisphere. Left is left and right is right. So they activate the auditory cortices bilaterally, left greater than right. So now we wanted to see what would the monolingual French speakers look like, because based on our prediction from before, we would expect, and we do see it, that they activate only the right hemisphere. So despite the similar performance, they're activating different regions based on their experience. So we then wanted to know what would happen to the international adoptees. If they have no conscious recollection of tone and they haven't been exposed to it, and they're now monolingual French speakers, they could look like the monolinguals. But if there are still traces left in the brain, even 10, 12, 15 years later, then they might look like the Mandarin bilinguals. And that's what they look like. So strikingly similar activity, even though they hadn't been exposed after the first year of life. And when we overlaid the international adoptees and the bilinguals, the same brain regions are activated. And then what we found is that the later they were adopted, so the longer they were exposed to the Mandarin tones, the more they activated this left planum temporale. So we then wanted to see what's happening when they're processing French. What's the basis for having this scaffold of keeping Mandarin why would they have these traces left in the brain? So we did a non-word phonological 0 back, 1 back, and 2 back task. So these are non-words following the phonology of French. And what we did is we looked at the monolingual French speakers. So these are people who have spoken French all life. So what they do is activate the left insular cortex, the left anterior insular. And then we look and see what happens with the adoptees. So even though they are monolingual French speakers, their pattern looks completely different, even in the French task from the Mandarin French. And it looks, from the French, and it looks similar again to the Mandarin French bilinguals. So even though they don't speak Mandarin any longer, their brain is still processing as if they are bilingual. And when you compare the monolingual French to the bilingual or the monolinguals to the adoptees, it's this left insular that's activated in the French speakers, French-only speakers. It's not activated in the other two groups. And when you increase cognitive load, so you look at the two-back condition, the Mandarin learners and the adoptees are activating a whole lot of cognitive control regions in order to perform at the same level. They all form the same, but they recruit different brain regions based on their brain experience. And I think this is quite important to know, because even though all these people come to school speaking French, their brains are all quite different based on their different linguistic background. And this could affect, our brains, parts of the brain do not all develop at the same rate. And so you could assume that everybody's going to have the same ease in dealing with processing French at school, but our linguistic experience is influencing how we're engaging with these tasks. So I think that that's quite an important take-home message from that. So we then looked at what happens when you have delayed first language acquisition. So what happens when you are born congenitally deaf and you might only get to be exposed to language quite late in life? And this is work that I did with Rachel Maybury, who had done a lot of behavioral work on people born congenitally deaf. And so she showed here just that early spoken language and early sign language do very similarly on a grammaticality judgment task, but those that are not exposed early have very poor grammatical skills. She's also shown that those people that learn sign language early do similarly on a whole lot of cognitive tasks to people who learn spoken language early, but learning sign language late has lots of implications for secondary language learning, like reading and other skills that are dependent on an already established system. So we put them in the scan, we did the same task, and we divided them into native, early, and late. And what you can see here, so you can see the brain, this is the frontal lobe, this is the back of the brain, the blue and the red, and you can see that when they're exposed like native speakers, they activate that left insular region like you saw for the French speakers, so an area that's important for language. When they learn it early, between 3 and 7 years, they activate it a little bit, but when they learn it late, after age 7, they do the task visually, so very superficially, without access to the information, so as if our brains, the template doesn't get laid in the left hemisphere, and they do this task more based on the signs than on the meaning of the words. And we did a regression where we looked to see, and the earlier they learn it, the more they activate the left insular, and the later they learn it, the more they activate the occipital cortex. And it's around age 7 that this change takes place. So it's really important. I think this is important, all these pieces of information about how our brains are set up within these first years of life. For example, for questions about cochlear implants and sign language, really important that somebody gets exposed to formal language really early within the first year of life for optimal language organization. So then we've just been asking some questions about biomarkers for predicting language learning success. Are there individual differences? And we've been wrapping speech samples around intensive language training courses at McGill. I think I had a little something for you here.
Very good practice.
All right, so we wrap them around. I've been doing a lot of tests where we've been looking at things, but one thing I've always been acquiring whenever we've seen a participant is a speech sample. And we've never really known what to do with them, and we've always just been getting them because we want to hear how proficient the person sounds. But I had a student, Shao Chen Chai, she's at the Neuro now, and she said, you know what, let's use the speech samples and mine them and look at patterns of performance to predict learning success. So that's what she did. She took the resting state connectivity. And what you can see, this left insular region, which seems to come up a lot as a region that's important for language. Those were stronger connectivity between that region and the left STG. The greater improvement in the number of unique words produced during their spontaneous speech. Those with stronger connectivity had greater improvement in the number of unique words produced. And then in another group, those with stronger connectivity between the left visual word form and the STG had greater improvement in reading speed. And they're not the same individuals. So this speaks to the fact that we all have different skills. Our brains have different connectivity patterns that might make us, anecdotally, some people say they're more visual or some people say they're more auditory. There might be patterns of connectivity in our brain which lead to different successes. So that's something we've been working on, and we've been segmenting the language tracts of the brain and relating that. So here, the left long segment of the arcuate fasciculus was related to lexical retrieval improvement. So when I came to the neuro, I came to work with Brenda Milner, and the neuro is a neurological institute. And we were doing PET scans, and we presented some of our work just at a student day. And the surgeons got interested in this slide that I had. And they were interested because they saw that you could lateralize to the left hemisphere and you could localize. And also you could test patients in any language because we found the same regions involved within and across language searches. So they started sending their patients. And Dr. Milner had always said to me, don't set out to try and be clinically relevant. If you do good basic science research, somebody will always find it useful. And I think that was an important lesson to learn, because I had been feeling quite guilty about putting radiation in healthy controls arms, but just 12 of them led to the study. And now we've been doing pre-surgical mapping for the last 30 years, over thousands of patients finding where language zones are before surgery. So after that, they started sending their patients. This was a patient with epilepsy who was trilingual. They were a simultaneous translator. They spoke Spanish, French, and English. And we activated the regions before she had an operation. We had a patient who was Inuktitut, and we could, because we knew about translation, we gave them the words in English and they produced the response in Inuktitut, and she had a removal of an arteriovenous malformation. These are patients with brain tumors with zones close to language cortex, and you can lateralize and localize the activity, and you can relate it to the vessels in the brain, the lesion and the activation focus, and you can plan the surgery before they're having the operation and help the surgeon do a smaller dissection and give the patient a better idea of risks that are involved. And the other thing I wanted about was careful observation behavior, because there are huge databases now that people for all these banks that are out there, but not all of them have behavioral information. And I think it's really important, no matter how fancy the imaging that you have, to relate the brain to behavior. And so I've become quite interested in speech samples. The reason I got interested in this is that I heard on the radio somebody talking about Muhammad Ali. Now, I don't know if people know who Muhammad Ali is, but he recorded his speech throughout his life. He was an amazing boxer. And at the height of his career, they say that they could decipher that he was showing early signs of brain damage. And they showed this by slowing of speech and changes in his vowel space. And there are other studies. There's a longitudinal study of nuns, which is quite interesting because these are all people who live in the same environment, eat the same food each day, live the same, do the same amount of exercise, and they all wrote autobiographies within the first 2 years of their entry. They had annual cognitive testing, and what they found is that what they had written in their diary in their teens and early 20s predicted which ones of them would go on to develop dementia. So that's from written diaries. Muhammad Ali was from spoken speech, and they also found in the nuns that those that spoke more languages were delay in developing dementia compared to those that were unilingual. So now we got a data set from Nathan Spring, who's at the Neuro, and this was autobiographical samples, and we had a training set and a test set, and he related the speech samples to neuropsychological variables, just to get a proof of principle. And we've been working with the Quebec Parkinson's Network. But one thing I wanted to say is that nobody at the Quebec Parkinson's Network was evaluating speech, because it's not a symptom that is diagnostic normally for Parkinson's disease. It's usually motor symptoms. But they had all this incredible database with nobody asking for a speech sample. So I started collecting them on all the patients that were coming in. And here you can sort of see, even just visually, the controls have more modulation in their speech than patients. But we can look to see, for example, phonation, how patients differ from controls. And we can relate speech samples, which I've been doing with Peter Dohaza and Alex White. We rated speech samples of Quebec Parkinson's Network, and then we related it to the magnetic encephalography that the patients were having. And in a group of patients with Parkinson's disease, the more significant the spectral deviations in the left frontal cortex, the more evident the articulation deficits in the patients. So we can start to try and tease apart what might be going on. And now we are looking to take speech samples from the Parkinson's Network. I'm working with Mirko Ravanelli to use deep learning, look for more subtle features in the data, to look at risk, disease progression, and also because in Montreal, we are really in a unique position to look at not just prediction, but to relate it to the brain, to treatment, to genes, because we have access to their medical records, so that we can increase our interpretability, but also maybe to have some kind of disease agnostic way of identifying what might be happening, because speech is cheap. Very easy to obtain, and maybe we can add additional information. And also, one thing that I think is really critical for Montreal is the idea, because we have so many bilingual people here, of not only looking at English, but looking at how, for example, how accent interacts with a dementia diagnosis, speaking in a second language. I think these are really crucial challenges that will need to be worked out. So I'm nearing the end, but I thought I'd play you.
I really like this mix. I'm changing all the time. I go to the grocery store, I'm talking French, I went somewhere else. My concierge only speaks English, Nova Scotia, I'm only speaking English, I'm back and forth. It's very good for the brain. You know, it's been shown. This switching process is very good for your front lobe. It's me, it's part of the whole richness of life. And to me, because language is very important to me, I don't have many other skills. It's to me very, very important. So that is a huge plus for Montreal. Really?
So I'm going to end by saying that to me, the way that we examine language and speech and integrate it in our perception of the global world is really important. And that asking all these kinds of questions, not just about, allows you to have a view into the brain, to ask questions about how two languages are represented in the brain, but also about brain elasticity and also about health and about disease. So it's just a model for being able to address all sorts of questions about skill and learning and human communication. And I'm not the only one that's working on language in the brain. The CerebrUM has 80 members, 400 students. We are at 2001 McGill College, and this is an open invitation to whoever wants to interact with us. We do have a newsletter that you can sign up for, and if any of your supervisors want to join as members, they're welcome, and then you have access to all our facilities. So that's just to say, and as Karim and I discussed, maybe doing some common activities with Unique and CerebrUM could be a good way of starting that. So I want to just highlight the students if there are any here that you didn't see in the work, and I'm open to questions. And I love this because my husband did it for me. Or during COVID. So, yeah.
I was wondering, I don't know if you did this exactly, but did you like compare between, let's say, Chinese Mandarin and English? They're saying the same word, and then you see which part of the brain is there or not.
Yes, so I mean, we've done many studies with Mandarin and English. The PET study at the beginning was one where they were speaking out loud in the scanner. Most of the studies that we do with fMRI are actually not overt. We don't do speaking aloud because of motion artifact. You can actually use sparse sampling, which allows you to do that. And we have done some tasks with reading in the scanner like that. But when we do tasks where they're generating in the MRI, it's usually covert. So they're just thinking it in their head. But we found that you get the same regions activated.
So the same word in different same region, right?
Yeah.
So did you like try, let's say they're thinking about a sentence, try to like quote of this sentence in the brain?
So you can do these things, but we haven't. And MRI is not the best tool for looking at those kinds of questions. And I'm not good at EEG and MEG, but to follow online how somebody's processing something, there are better tools. I mean, behavior, eye tracking, all of these kinds of tools would be better for if I understand you correctly, if you're wanting to see. We did do one study because I was interested. We had looked at subtraction of one language from another, and we had seen that the frontal lobe peaks disappeared, and we wanted to know whether maybe that was something to do with the analysis technique, that there were still populations of neurons that might be slightly separate. So we did an fMRI adaptation study where you present words one after another, and then you change at the last minute. You either present house, 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 maison, house, 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 flat or apartment, or do you know what I mean? And you manipulate those things. And what we found is that the change in meaning was more important than the change in language. But then what we did is we realized that fMRI is not the best tool for that. And I read the study with Natalie Phillips from Concordia using ERPs, because to really look online at how somebody, whether we were inferring a recovery from adaptation, that the brain changes. The idea is that the brain responds when something new comes along, and that's how you see if new populations of neurons are involved. And I think you can follow that. Karin's more of an expert on this, but you can follow that better with online processing tools or ERP or things like that, better than you can with MRI. Because with the fMRI, you have to choose when you're going to scan. And you either have to scan during noise or in silence or when they're making the decision. You can't, in the studies that we've done so far, you can't scan all the time.
Thank you for your talk. I was wondering about the group for adoptees, monolingual French adoptees who spoke Mandarin before 1 year old. Did you have a subgroup of people who, after that, in adulthood, started learning Mandarin again? And then would they have easier time to like pick up Mandarin, and would it be comparable? Or did you have any people who did that?
Yeah, so we're working on that at the moment, but there are people who have done these studies behaviorally, and they, in their hands, they have shown improvement. I do have a slide where you can sort of see, but it's not significant. So the adoptees, if you're looking at tone learning, the adoptees look like they're learning a bit better than the French, Pascal. But I think that I think that they don't lose. Maybe they will benefit. And I mean, like, we're only looking at like a task in the MRI, so it's very short-term learning. And we only took people who hadn't been exposed to Mandarin. So maybe we try to get people to come back to do an online task like in the lab for 5 days. But very few people came back because it was during COVID. But I think I'd like to try and tease out. I think that they don't lose the language because you have to retain a trace in the brain of a language. And if they lost that, they would be at some disadvantage, which they're not. But I'm not sure whether, I mean, probably all of us have some benefit of something we've learned for later learning. But I don't know that they're going to be that significantly better at suddenly becoming really proficient at Mandarin. But that's to be tested. Yeah.
Well, it could be another interpretation. So correct me if I'm wrong, but it seems that exposure within the first year of life sets the stage for a bilingual brain. And once you've had that in your first year of life, those structures are there. And perhaps these adoptees would also show a quicker improvement at learning any novel language and not just the initial language that they were exposed to. This is something that could be, I mean, the scaffolding is there, and so.
Yeah, so it's an interesting question. I'm not sure that anybody's looked at that, although I do think that the group did have a control where this was, I think in Australia, it was Kathy Best, I think they did look at like a non-tonal language, and they found that it was, or a comparable language, and they found that it was specific. But I may be wrong, but that is an interesting way of testing them. Yeah. Sorry.
I have a follow-up question on in that study. So you showed that the longest the exposure was, or the time of adoption, that the effect was larger.
Yeah.
So did you find any, like, is there a minimal time of exposure to have this kind of plasticity for bilingual brain? Or, for example, did you have any babies who were adopted like at 1 month old, or so, and you didn't see any effect because the exposure was not long enough?
So our samples are really small, and because I mean the first study, we've done 2 studies with international adoptees. The first time we got people, and we did it with an agency. And the agency gave us all the adoption papers, and we knew all the details. And the second time we did it, this is this tone learning stuff we're doing. We recruited people via Kijiji and those kind of things, and because we decided we'd get people to volunteer. And so we have slightly less. They know when they were adopted, but we don't have much information. So we don't have a huge group. So So, I mean, that's a question. But one thing that I've got masses of data on that we've never published is that I think that there might be a period where actually teaching, and so, you know, there's all this debate about when's the best time to teach a language. And we have like between 1 and 3 years of age, where I actually think introducing a language then actually introduces instability. But we haven't, so I think if you learn it very early, or you learn one's well established and then another one. But because in that group, we always find that they're performing weirdly. But now I'm trying to gather all that information, because we've always kind of decided to leave them out and just focus on the early and the late. Now I'm going to go back and look, but I'm not sure that it's like 1 month or something like that. I think it's like actually when you've kind of vaguely got it all sorted out in your head, and then you introduce something else, and then something sort of doesn't. So maybe there's like a period of time where it's actually less optimal. But that's just my thought. It's not in any way something we've proven.
Thank you, magnificent talk. I have a question related to, at some point you mentioned speech and noise.
Yeah.
And so the separation between my processing of language or speech and background noise. And I'm wondering whether, for example, there's any data showing that bilinguals or multilinguals have a benefit in terms of, for example, being able to shut down the environment. So, for example, there are some people that work really well in a cafe, a lot of noise, and can go in a cafe and just sit down. Would a bilingual or multilingual have better chances, or some people say that never can do that. Some people can't work with music. Others say, no, I can work perfectly with music. Did you see a link potentially between, because you did say that there's bilinguals have an ability to sort of extract information out of noise.
Yeah, well, I definitely think that, I mean, you know, if you're being exposed to one, I mean, this is just in my head. I'm not, I haven't done the experiments, but I mean, I think that babies, there've been some studies where they've shown that babies, now I can't remember who showed, but they can deal with more like complexity if they have been exposed to more than one language. So because they have to learn the two phonemes are associated with two different things, they're having to sort of juggle in their head, you know, all this ambiguity in a way that, like, if you're exposed to only one. But I'm not sure, like everything in the brain, there's always a pro and there's a con. Like, you know, Stanislas Dehaene showed the redundancy, the recycling hypothesis, that you lose some face processing neurons in order to become literate later in life. Well, is there a limit on all of these things? And like, is there a loss somewhere else? So we're testing one thing, but we're not testing the whole span of cognitive ability. There's probably some loss somewhere where there's some benefit. So I don't like to think of it in terms of advantage or disadvantage. I just think it's different. I mean, it's just, you know, firstly, we don't get to choose whether we have a monolingual or a bilingual environment. And then, you know, it's like with everything in life, if you grow up in a noisy place, you'll learn to live with it. But the one thing that I do think is, noise is a strange thing. When I say speech and noise, that's one element. But, you know, I know that in the operating room, when I go in, when patients' language is starting to break down, my accent is the first thing that they start having trouble with. And the same thing when they're recovering from the surgery, my accent is the thing. If I ask them to repeat sentences after me, they cannot do it. If I put somebody who's Canadian in the room with me, they can respond to the Canadian for longer than they can. So that's noise in the system. I mean, noise is many things. And it's like, so maybe bilinguals can deal with some things, like here we're just asking them to differentiate. But, you know, noise can be many things. But I do think that being exposed, I mean, in the study that Howard Churko did, he actually said it was immigrants and not bilinguals that were 4 years. You know, when they did that thing about the bilinguals were, the dementia was offset by 4 years. And they said it was offset by bilingualism. And then they did a retrospective study. They found that it was immigration. I mean, I think these things, there's so many factors. I mean, that's the problem with analyzing data. You focus on one thing. So
even when you say bilinguals,
yeah,
I mean, French
and Italian is a form of bilingualism, but it's very different from, let's say, Italian and Chinese, or I grew up with French, English, and Arabic. So Arabic is very different from the other languages. So presumably some of the results that are reported about bilingualism in general should probably be split down into different forms of bilingual, how similar the languages are sometimes. Or do you think that's
Well, I think there are too many factors to answer like your specific question. I know when I'm watching TV, if I'm watching and the French is in the background, I can mark a student's PhD thesis and I won't be at all lured into seeing what's going on. But if I'm sitting in front of the TV and there's English in the background, I get intrusions all the time. So I think it depends, like when you're in the cafe, what, you know, is the music, what music are they playing? You know, are the songs coming to you in English, or is it background music? So many factors. I think that's one of the things that's sad about all the work that we do, and why it's quite interesting that now we're able with new techniques and things to look at more natural situations, is that there are lots of questions that, and that's partly why I'm drawn to the speech sample stuff as well, is that maybe these tests that we used were very artificial, and they do give you some insight. So I have seen that doing single word tests are relevant for like determining who might have trouble post-surgery, and they do. So single word tests are not useless, but like life is so complicated that to sort of tease apart all these things is hard.
We cannot end on this note. You need to add something else. Life is complicated.
You ever look into the language in which people think in bilingualism, especially like people who learn it, simultaneously? I guess the thought is, do these people who learn it simultaneously learn two languages simultaneously? Do they have kind of a latent language that they kind of end up thinking in, since they kind of were exposed to two languages at the same time?
Yeah, so I haven't done any of those experiments, but I mean, most of them have a mother tongue still. Like, I mean, they usually have like a slightly more dominant language. But one of the things that we are looking at is like, we've been getting people to rate how English or French they sound, and they don't sound like either. So they have kind of their own, you know, so there are, and I think Grosjean said that like somebody who's bilingual is not a monolingual in either language, but a bilingual. So, I mean, there must be something, and I'm always in awe of people who switching between languages on the bus, and you think that they're English speaking, and then suddenly you think they're French speaking, and then, you know, I mean, it is amazing. But I think that people do generally, if you ask them, they have one that they're still slightly more comfortable in, even though we consider them simultaneous bilingual, because they probably get exposed, like to say their mother is English and their dad is French. They're not getting 50% of the time in both languages. They're still getting maybe 70-30.
So let's say you find in your data that, for example, someone or many people who thought about house, like you said, and then they thought about maison, and then the results are quite like they are different parts of the brain. Would you say it would be mainly because of this effect of the sound on the body, and also because even though they're thinking about it, they have to be in parts of their vocals. Would it be because of that, or there is another reason for spacing maison and house?
For lexical search and retrieval, it doesn't matter. I've seen it a million times. No matter how good or bad you are to the task, you still activate that region. It's a region that's involved searching, and I mean, many parts of the brain are involved in doing that task, but that region is quite important for searching and retrieving for the word. The area that's involved in articulatory control, the basal ganglia, is more likely to be activated the less comfortable you are in producing the response. So, we have looked at quite a lot at the role of the basal ganglia in speech production, and I actually think it's got quite a bit to do with identity. You know, I always think of what was his name? The guy who had the computerized voice.
Okay.
Because, you know, he didn't change, even though the new machines became more available to have a British accent. He kept the American one because that had become his identity. And there are patients with foreign accent syndrome, which is a disorder where the timing of the speech changes so that it mimics a foreign accent. And a lot of them have quite profound sort of psychological issues with. So I think that there is something to do also with how the brain kind of comes. I mean, articulation is something that you probably learn quite early in life, and it's linked also to your perception and then your production of the correct sound. But I think it's also to do with the fact that I can't coordinate the organs of articulation for a second language as automatically as I can for the first. And that's why you get increases in activity in regions that are involved in that. So it's like the production side of things.
Thank you so much for that.
Yeah, thank you.
Je pense en ukrainien, non, c'est changiste, c'est bizarre, j'ai eu une changement en, j'ai pensé en russe, puis j'ai commencé à penser en français.